Chairman of the Health Select Committee, Steve Bryan.
Happy New Year. The Secretary of State will know that it is far from all doctors in training who have taken part in this strike. In my trust, Hampshire hospitals, it's just over 60%. The average across the South East was little more than 50%. Many doctors were hard at work this past week caring for their patients. But does my right honourable friend share the concern of many in the health service that the longer this dispute drags on, we were losing the goodwill of the consultants who've been filling in, and we're doing serious damage to the career pipeline that sees today's doctors in training becomes tomorrow's consultants?
Well, may I thank my honourable friend for asking that question, and indeed for noting the enormous efforts that clinicians across the NHS have gone to in order to cover these strikes. We are very conscious of the personal impacts this has had for many. As I say, clinicians have had a very tough few Christmases, and we were all, I think, collectively hoping that this Christmas would just be a little bit easier for them. But sadly, these strikes have the real-term impact on people who are working to pick up the slack from junior doctors not turning up. I'm very, very grateful to everyone who has gone into work, who has worked extra shifts, who has cancelled time off with their families, and we must find a fair and reasonable solution to this industrial action, which is precisely why I was so very disappointed that the BMA Junior Doctors Committee chose to walk away from these discussions.